What are your concerns that you have regarding diabetes and this information that you're receiving?
Well, I really want to get my sugars under control. That's important. You know, it is really hard for me to keep to a strict diet and exercise. You know, I don't want to gain weight on any medications.
Understandable.
You know, and certainly, you know, just trying to, you know, make sure that the side effects of the medications don't, you know, complicate me at work and,
Right.
you know, my home life. And
Yeah,
stuff.
fully understand. So what I'm hearing is you really want that glucose control right away. Obviously, weight is a very sensitive factor. People don't want to take medications that can aggravate or cause weight gain. And those are things we can look at. So let's just really, without making too much detail and trying to get you to remember all these medications, let me just run through some of what we do have available as far as our medications. You know, 20 years ago, this would be a very short discussion. And today we have so many new medications which are wonderful. It does help with therapy, but it somewhat complicates choices because we actually have maybe too many choices, which is probably a good thing. So just reviewing here, and I just want to show you this slide because I think it's helpful for our patients. This is the ADA guidelines from 2015, and what we talked about was therapeutic lifestyle intervention, always critical number one, and it's also add-on to metformin therapy. Metformin is our number one mainstay therapy, came out in the mid-90s in the form of glucophage. And if we look over here, all these medications, let me first say this to you, every medication I could possibly put you on, it's pretty much going to get you to goal because you're starting at a 7.1 A1C and we want you down as close to 6 as possible while minimizing that risk of hypoglycemia, but also choosing a decision of choices that makes you feel good about what you're doing in your decision-making process. So metformin first line therapy, then we look at adding on these other therapies to it. So these sulfonylurea medications is a medication that stimulates the pancreas to make insulin to help lower the blood sugars. Very effective, but it can cause weight gain, and of course can be associated with low blood sugars, and we'd like to avoid that. These TZD class right here are good, very effective, may have some weight gain with it, but it really tackles the root of diabetes. The root within diabetes, one of the principal ones is insulin resistance. Your body is resistant to insulin, and your body really should be sensitive to the effects of insulin. So when you take insulin, when you make insulin, it hits the receptors of the body and allows the glucose that's in the sugar to go into the bloodstream, in the cells, and that's how we dispose of glucose into the cells. And then we have this class called DPP4 inhibitors within your stomach, within your intestines, within the gut. We make a hormone called GLP-1. And GLP-1 is really a great hormone in that it stimulates our pancreas to make insulin when we eat, and then it keeps our liver from dumping sugar into the bloodstream when it shouldn't. And diabetes patients don't make enough insulin and their liver releases too much blood sugar, and that's what aggravates everything there. So that's really in a pill form, very effective, weight neutral. SGLT2 inhibitors, that class there, for example, diabetes patients actually reabsorb too much glucose from the kidney, and this one actually allows glucose to spill out through the urine and therefore lower blood sugars. Again, very effective, and then it's can be associated with some weight loss, 5, maybe perhaps 6 pounds. The last two therapies under here are very good, and those are injectable therapies.
I'm not really interested in injecting at all.
All right.
Yeah.
So great therapy. So maybe we can talk about this later if need be, and I want to respect your, the desire of injections, and people are afraid of injections. And at least we know we have these are great drugs that can be reserved for another time. And knowing that diabetes is progressive, we usually add medications, and inevitably, 10, 15 years perhaps, you may need to add some form of an injectable therapy, whether it's a non-insulin or an injectable, type of therapy at this point. Any questions or any direction that you see what you'd like to choose as far as the therapy?
Well, the simplest, I guess, for me. The less side effects is best, but I do want to get my sugars under control, like you had said, pretty quickly.
Yeah, and your labs look good as far as kidney function, liver function. I think everything here looks wonderful. So, the recommendation that I would have for you would be to use metformin, and I would prefer to use metformin extended release preparation. With the history of IBS, I don't want to aggravate anything from a gastrointestinal standpoint from you, and we could titrate that over a 4-week period. So we could use metformin ER. You can take it all at once, or you can take it into divided doses, but our goal is 1 pill the first week, 2 pills the second week, 3 pills the third week, and then 4 pills the fourth week, 2 twice a day, or all 4 at once. And this will all be written on the directions
Okay.
before you go. And I'd recommend that you check some blood sugars. And I see that they gave you a logbook when you came in, so right away. So maybe checking blood sugars 5 to 7 times per week. One day first thing in the morning when you're fasting. The other times to check it is probably 2 hours after your largest meal to see when your body's been challenged by a higher carbohydrate load, how does your body respond? So I would recommend the titration schedule of the metformin, ER, and then the blood sugars. Any other concerns that you have questions regarding starting metformin? Or?
Any safety concerns?
Okay. So the largest thing I think, or the most important thing to probably speak about is really the GI stuff, because you're a healthy female, you got great kidney and liver function, and patients that have impaired renal function, significantly impaired renal function, like what we call CKD3, chronic kidney disease stage 3, we need to start being careful with utilizing metformin in that mid-range category, but you're ways out before we need to be concerned about that. So other concerns of patients that consume high amounts of alcohol, 3-4 drinks or more per day could be an issue. Patients have a history of lactic acidosis, and none of this of which applies to you. So I think it's a great medication. We have a great starting point right now. I would encourage lifestyle intervention, of course, for whatever you're capable of doing, and then that titration schedule that'll be written out for you, and then those blood sugars, and let's just plan to have you come back in a month with blood sugars in hand.
Okay.
Should you encounter any questions or concerns along the way, please give our office a call and we'll make sure we address your concerns.
Okay. I'll give it a try.
See you back in a month.
Thank you.
All right, good to see you.
Bye-bye.
Hey Maria, great to see you back.
Hi, nice.
How's everything going for you?
It's going good.
Good.
Going good.
You have blood sugars for me,
I
right?
do.
Are you hesitant to hand them to me?
No, they're looking good.
Good. Let's see
They're
how we're
really
doing
looking
here.
good.
All right. So yeah, you're running right in that 95 to 114 range in the morning. I like to see those mornings 80 to 120, so you're right on target. And it looks like here, for the most part, all your daytime, you got in some 2-hour after meal blood sugars. Wonderful. Highest one looks like it was 161. Everything else is probably 110 to 120. So outstanding. So doing metformin, we've worked our way up. It's been a month now since we've been on the metformin. So lifestyle, any change there at all? I'm always going to hit you about lifestyle. So.
I've enrolled my daughter in soccer, so she'll be going 3 to 4 days a week, and I'm going to be taking her, and I'm going to walk while she's playing.
So you have a plan.
I have a plan.
Excellent, excellent. So, your sugar's looking great. How are we doing with the medication?
Not too good. Not too good. It's too much diarrhea. It's too much running to the bathroom. Stomach cramping. I'm just not doing well with it at all.
Okay. So welcome to the world of 5%.
Yeah.
Remember we talked about in the last visit, we said that, somewhere around 5% of patients just don't tolerate it. There are some patients that tolerate it well enough to stay on it. And then there's other patients that just can't. And it sounds like to me that you just can't tolerate it. Let me ask you this. So we use the extended release formulation versus the immediate acting, and I think you would, if we'd had a better chance. And I had your IBS in mind when we did this. How did you do when you got to the second week when you're on 2 pills?
Everything just started increasing as I was in.
So thank God we had all these other choices last time. And so let me just reiterate. I remember you said to me that the glucose control is important, and we're going to get that no matter what. Weight was important, and side effects were important. And no injections. No injections. Okay, so still not up for injection, which is fine. So I would at this point suggest probably one of two. And if you remember all those medications we talked about, so let me just talk about really the 2 that would really address getting us to control, either being weight neutral or possibly having a little bit of weight loss with really a good tolerability. And those 2 drugs would be the DPP4 inhibitors, which we talked about last time. A good medication that gets your A1C down for certain, great tolerability. It's a smart drug, doesn't cause hypoglycemia. That's the one that allows your pancreas to make more insulin and keeps the liver from dumping sugar after meals. It helps restore normal function for the type 2 diabetic patient. The other one was the SGLT2 inhibitor medication, and that's the one that allows you to release glucose through the urine, so you excrete the glucose, so you're not reabsorbing all that glucose from the kidney and aggravating or causing hyperglycemia. Both are good agents, both very effective agents. Maybe my personal opinion, if you will, just years of experience is that the DPP4s have been out much longer than the SGLT2s, and that doesn't mean that 5 years down the road we may not think differently. But from a physiologic standpoint, I think the DPP4 inhibitors are good drugs, clean drugs, once daily medications. But again, this is your choice, and I'm happy to go either direction with you on that one. Do you have a preference of what you like to use?
Well, I'm willing to give that a try.
Okay, so let's do this. Those are all branded medications.
Okay.
Nothing's generic, and if you've got good insurance coverage, I know that cost becomes an issue, and we can certainly look around. Some are preferred on formularies and some are not, so we can work around that. But we've got some samples of something we can give you today, and we'll see what's available for you.
Okay.
My suggestion would be the same as last time. Now it's one pill each morning, with or without food. And I would say on the blood sugars, no more than even, I think, 5 to 7 times a week. 5 times a week is fine. Mixing them up just the same. This medication, again, will be very effective. Don't look for hypoglycemia. Don't look for weight gain with this particular medication. And I would work at that lifestyle part of it. Any other concerns regarding where things are and where we're going with things?
Any major side effects to that medication?
Yeah. So tolerability is outstanding,
Okay.
so we rarely have to stop anybody from it. The one concern you may see sometimes in advertising, et cetera, on news is they might say if you've taken a particular medication, they're at risk for whatever, and they call an attorney firm, for example. What I want to kind of ease your mind about. So the one concern that may happen in post-marketing studies is there was concerns about possibly some pancreatitis in that incretin class, those DPP4 inhibitors, and that injectable one, the GLP-1 receptor agonist. What I would say to you is that as a diabetic patient, or patients with diabetes, your risk of pancreatitis is about 3 times higher than somebody without diabetes. So there's the risk factor. You've never had pancreatitis, no gallbladder issues, gallstones, nothing like that.
Nothing.
And usually there's nausea, vomiting, and abdominal pain. If anything of concern comes to mind, or you're just concerned, you don't seem like a worrier. So,
No.
but if you get concerned about anything in particular with regards to medication, just give our office a call and let us know. So the plan would be 1 pill once a day, blood sugars, and I would say that let's plan for a return visit in a month, and let's see how things are going.
Okay.
Hey, great to see you
Thank
again.
you.
Best
Thanks a
wishes
lot.
to you.
Thank you.
Maria, great to see you again.
Hi, nice to see you.
All right. So how have you been?
Great. Everything's been going
Excellent.
well.
So we've been on the medication for a month, right? Tell me something good.
It's good. No side effects. Taking it once a day is great. I'm exercising. I've got myself in a little schedule for exercising when my daughter goes to soccer. So I'm doing that 3 times a week, 4 times sometimes.
And how many minutes each time?
30 to 40.
Good. So roughly getting in that 120. So trying to get to that 150, you're darn close. Good. And that's within a month. How about the blood sugars? How are they doing?
Good. They're great. Yeah.
Are these bragging rights?
These are bragging rights.
That's how we're doing. These are the same as last ones, aren't they?
They're close.
They are. They're really excellent. Wow. Outstanding. Well, I like how you put the smiley face beside it. Very nice. Very nice. Well, you're doing outstanding with regards to blood sugar. And is this all medicine? Possibly. I want to make sure that you definitely give yourself the accolades and credit for the lifestyle, because it's the hardest thing to change is lifestyle. And I think with the lifestyle continued, although this medication we said is weight neutral, I would still think that there's an opportunity for you to lose weight because you're not going against the grain of a medication that can cause weight gain. At this point, I would definitely encourage you to keep the lifestyle going. You might even consider, if you use a smartphone like most folks do, even consider using one of the apps that are available. Some people use the Fitbit, and but some of the apps like MyFitnessPal is a great app. You can put in your current weight, how much you want to lose, and then it'll tell you how many calories to consume, and you can put in all the calories you consume per day. And it's a nice way of tracking to have that. Live Strong is another really good app. So I think those apps really help you hold accountable, and it's almost kind of similar to the speedometer on a car. You have something to look at, the whole time. I think that'd be wonderful as far as the way things are in fact going for you. Any other concerns or any questions that you have right now?
No, not right now.
Yeah,
I'm doing good.
Yeah, and despite the that frustration of the metformin, no big deal, and it's probably a drug that we'll just have to put aside because obviously from the side effects. So we have a lot more options, and we can always add medications on, as need be down the road. What I would say at this point, I'm not really sure that I would even encourage you to check blood sugars at this point, because you're not having hypoglycemia. Your sugars are doing much better. So if you want to check them, 5-10 times a month, just out of curiosity if you want to, certainly welcome to do that. we'll have you come back in 2 months. So when you come back in 2 months, let's get that A1C and
Okay.
let's be getting that goal. I'm quite certain you'll be below 6.5, and if we can try to get that 6% or anywhere above or below that, just above or below would be outstanding.
Okay.
And we can send in that prescription for you again if you'd like. If 30 days or 90 days, whatever we need to send in for you, we can take care of that for you. Anything else I can do for you?
No,
Anything
thank
else the
you.
staff can do for you?
No, thank you.
All right. We have books here. If you need more books, pick them
Okay.
up at the front desk before you go.
Okay.
See you back in 2 months.
Okay,
All right.
thanks.
Wonderful to see you again. Take
Nice
care.
to see you. Thank you.